Adamawa State is set to witness a positive revolution in healthcare services. This is the promise of the Admiral Murtala Nyako regime in the health sector. When the government came in on the 29th of May 2007, the situation in the health sector was more of window dressing. The 6 general hospitals in the state supposed to have been were under repairs. These repairs were never time-bound. It was meant to be smoke-screen to show people that government was working, while in actual fact, not much was being done. As a matter of fact, the supposed repairs served only as conduits for siphoning funds by the operators of the system. Worse still, some of the key healthcare centers were totally abandoned. Some were so debilitated that they not only constitute hazards, but in fact, they provide neither health nor safety. To further add salt to an already troubling situation, health workers from doctors to nurses, right to the lower cadres, have deserted the sector in droves. Their pay package was poor, condition of service dismal, and their future bleak. In the area of drugs and equipment, little was done to make public hospitals less expensive or more attractive to the common man. It has been reported that Adamawa State leads 5 other states in being responsible for the bulk of Nigerians' extremely high maternal mortality. About 4,500 women die every month during pregnancy and delivery. The state was also reported to be the highest contributor to the mortality of children who die at childbirth. Worse still, 1 out of every 20 children born alive die at birth, and 3 out of 10 children die before the age of 5. It was indeed a disaster situation, yet the situation was not considered alarming enough to attract special attention. It was as if the whole purpose was to fleece the common man and enrich the operators. All of these added up to make Adamawa State the worst in terms of infant and maternal mortality among the 36 states of the Federation. The situation, according to the Honorable Commissioner for Health, Dr. Zainab Kwamchi, is likened to what obtains in war zones.
1,500 mothers dying for every 100,000 live births. We are put in the same position as Darfur, a war-torn zone, while we are living in peace.
When Nigeria had problems with the world in the area of the spread of the wild polio virus, certain key states were most affected. One of such states was Adamawa. Reason, of course, is due to the fact that it is a border state. Poor immunization record in Adamawa State naturally affects our neighbors in Cameroon, whose coverage is indeed very high. That is why the record available proved very alarming. The state had the lowest immunization coverage of 23% compared to all other states in the northeast sub-region. Moreover, the state was recorded as having the 3rd lowest coverage in the whole country. This dismal performance by the state in the area of immunization could be directly linked to the high rate of infant mortality recorded during the same period. After all, 95% of deaths among children are due to vaccine-preventable diseases. Even though available records from the previous regime indicate a very high expenditure outlay in the health sector, performance indices show that there is a high rate of non-compliance with routine immunization in the state. The past government encouraged the misconceptions linking polio vaccines to family planning in order to spend less on the actual process. Various other diseases prevalent in the state such as malaria, tuberculosis, leprosy, onchocerciasis, and HIV and AIDS were virtually ignored. When people complain, it was attributed to political opponents. When professionals raised their voices, they were labeled enemies of the government. But the situation was real. In fact, the Nigerian Medical Association Adamawa State chapter was quick to throw modesty overboard and describe the situation as deplorable. In a speech during a courtesy call on Governor Murtala Nyako, the president of the association, Dr. Malgui, described the situation inherited in the following words.
It is very alarming that there are only 35 doctors in all the 14 hospitals in the state. 19 in the State Specialist Hospital Yola, 4 in General Hospital Mubi, and the rest of the hospitals only 1 doctor each. By this figure, 1 doctor mans about 250-bed hospital, which is deplorable by any standard and is far worse than what was obtained in the state hospitals 30 years ago.
Governor Murtala Nyako made a pledge to ensure a turnaround in the situation. He equally appreciated the support and sacrifices of medical staff working with the state government.
I would like also to listen to you on those areas that you think the state government, whatever intervention you think should be given to improve the lot of those who are in the profession.
Governor Murtala Nyako has a very revolutionary view on human development. He sees human development from an integrated approach. At the flag-off of Adamawa State immunization exercise, the governor was quick to link healthcare delivery with poverty reduction. Speaking to the people in Hausa, Governor Murtala Nyako said no progress will be made in providing healthcare without reducing poverty. The governor said his government will ensure that poverty is treated as a special disease that will be addressed as a matter of priority, while calling on women to present their children for immunization and to also patronize government hospitals since their standards has been improved. The Honorable Commissioner of Health, Dr. Zainab Kwamchi, also delivered a speech at the occasion.
The campaign is basically multi-antigen based. The immunization is for all children in all fixed posts, temporary fixed posts, as well as mobile posts. Immunization days should be conducted at least 3 times a year in the same wards, with at least 4 weeks interval between rounds.
The governor performed the role of an immunization officer, dispensing a few drops of the vaccine to a child as required. The symbolism of the governor's public display is to lend credence to the safety and desirability of the immunization process. Other dignitaries present at the occasion, such as the deputy governor, the chief of staff, the secretary to the state government and members of the State Executive Council all performed the exercise. Within 2 months of the launching and with an expenditure of just 20 million naira, the average coverage jumped from the dismal 23% to an impressive 62%. This is in line with Governor Murtala Nyako's vision, which he articulated as follows: to meet and exceed all the Millennium Development Goals as prescribed by the United Nations Charter on Human Development. In another development, Governor Murtala Nyako launched his free medical services program with a pledge to provide free medical services including consultations and free drugs to pregnant women and children under 5. This is quite revolutionary in Adamawa State. When the drugs were supplied, Governor Murtala Nyako had them brought to the open and allowed to be displayed so that all will see them and witness to the availability. Supporting the project, the Honorable Commissioner for Health reeled out some statistical data on the healthcare initiative of the Nyako regime.
A total number of 10,000 people were medically treated, 348 surgeries were done, 1,951 eye patients were seen and treated, 56 eye surgeries were done, 336 eyeglasses were distributed, 731 dental cases were seen, while 48 dentures were fixed, all free to the people by Adamawa State government. A sum of 21 million was expended for this project.
To ensure that the scheme is sustained, the sum of 38.2 million was made available at takeoff, with a further 20 million naira to be provided on monthly basis. A research component to the program was commissioned to ensure that the drugs to be supplied are not only potent, but relate to the nature of diseases prevalent among the target beneficiaries. The free healthcare program for women and children of 5 years and below will surely support the attainment of the Millennium Development Goals in the health sector in Adamawa State. Before he went on to inspect the drugs and commission the project, Governor Murtala Nyako made the following statements.
The recent survey indicated in one of the local government we have 3,000 deaths. 3,000. I don't want to say it loudly, therefore I'm waiting to go. Because it's a disgrace. Now, while other nations are talking about 2 out of 100,000 women died, delivered, we are talking about 3,000 out of 100,000. That is 3% of them. Minimum 3% of them died. That is 100 out of 100 women, 3 of them will die delivered. It's a disgrace.
A survey of the performance of the scheme conducted at some selected hospitals indicates a high level of acceptability by the people. At the Yola Specialist Hospital, there was a large turnout of women and children due to the confidence restored in the system. Most of these women came to the hospital believing that beyond just mere consultations, they will receive treatment free of charge. We even witnessed the free dispensing of the drugs to the beneficiaries. At the maternity ward, we witnessed women waiting for delivery with some of the vital needs made available free of charge. In the past, such needs for delivery had kept a number of women away from the maternity ward. One of the health staff explains the contents of the package and their importance.
The delivery pack used to come in package, the packet that I have showed you. 2 pads inside, 3 gloves, a Goya oil for cleaning the baby, 3 syringes, because when after delivering or when delivery we give an injection, and a cord clamp, and bleach was